All right, so our small video is going to be about those massage therapist tool. And I show this foam rollers, bands. Yeah, David is giving me a band because he almost gave it to me. Yeah, that's all right. So the bands, small balls, big balls, all kind of balls is help you a lot because people coming weak, and what's happened to them, they always think if you're working on that muscle, if you release that tension, it's going to be beneficial for them. No, because the muscle is already weak and you need to reactivate them. So that's kind of PhysioMassage. This is what I call is best because if you learn a little bit how to activate muscles, you already know kinesiology, and how to work muscle, you already know. And I show a couple examples. Yana, you want to be on the table? So all those hip flexors, all those glutes, any type of workout. Go ahead, lay down, face up. I'm just going to introduce few things. You don't need to take shoes, but that's all right. Go ahead, just lay down. Let's say weak glutes, hip flexors, SI joint pain. What I'm usually doing, I use the big ball. This one, I placed at both legs on that ball. And just like I said, you can use, and what I'm want to her, I'm not using for the older people, but for younger people with this lower back and on active glutes, this is the great exercise. Watch. And great technique too. Get your arms like this, like you do push-ups. Like imagine this is the push-up. And what I want you to do, I want you to squeeze that butt and lift it up. And look at this, how she's fighting up here. You see, I always ask him, what do you feel? Always exhale, let it go, exhale, let it go. What do you feel? Where's the weakness? Which leg is a weakener? Like where's like shakiness? You don't feel it? It's good. We're going to test it again. Now, tell me.
I will start shaking, but
in the core.
In a little while, not right.
Exactly. So how's that help stabilize the core? Look, how strong she is. Now I want you to start raise one leg and try to do one leg. No, just pick yourself up and lift one leg up. Look at that. And watch. On the one, you see, difficult. This is what I'm saying. She said this is difficult because this kinetic line is so strong. She used that kinetic line and it was really powerful. But when she started using the other leg, it's impossible. She's feel weakness. That's all right. It's only through this training specifically like this is going to help him. What I'm doing here, if she's feel weakness, what I'm doing, I get the small ball and I put that under her heel. Put it right there. No, just one. Yeah, just extend it. And what are you doing here? She's pushing down this ball. She's pushing down. What she's doing, she activates glutes, quads, hip flexors, everything. She's pushing down. Hamstring work? Yeah, everything. I can work on it. I can work on that muscle when she's apply pressure. And I see how she's doing that. Let it go. So this is the ball. Foam roller is the same. What I usually do, like I said, there's so many variation. I put that knee up, get that foam roller in between legs, and ask her to roll that roller. So roll one leg and another one. Exactly. So let me show you. You raise this up, and now you try to roll one side. You're going to do this lifting. Not this way, up. You try to get up. Try to get this.
I get it.
Okay, watch. When you lay down, you start trying to roll your hip up and down, like this way. There we go. You see how exactly right there. And I try to start helping her. This foam roller start rolling. How a lot of motion. What we're doing here now. That sacrum, that's fine. She's laughing because it's hard. And this is a lot of stuff. Core, funny. Core exercise. One knee, just one knee up here. Another arm, and you push it. Watch. She's pushing. You can raise up a little bit more right in here. So she push that arm, release that one so you people can see more.
Opposite side.
Opposite side, cross pattern. What she's doing here, she work on those functional line now. She's reactivate everything. I can work up here. She's holding it. I can work. I can distract her. I can try to push this leg away, and she try to fight me. So try to resist me. So I push away. Exactly. You see what's happening? She starts shaking. That's cool stuff. You can do all those foam rollers, longer one, short one. It's also good. Kettlebell, yes, that kind of stuff. Resistant bands, same. I put on the foot, let's say I'm working on my shin muscle. I show this many times. You can use the ball and the band at the same time. Watch, you put that band and ask her to move up and down. And you work on that shin muscle, you see? You feel them?
Ow.
She said, ow. Why? Because she's activating them. And I go a little bit, right there. Very slow. Don't rush yourself. Always watch how people sitting, lay down, breathing. It's really important to pay attention to this. And that's what they're doing. Up and down. Up and down. And you work on that muscle. So this is the tool, and this is great to have them. And guess what? You can resell it right away. Another one, really powerful one, working on the hips, hip mobility. Very tight hip, older folks. You get that band inside that leg. Let's say I'm working on that right hip. Put that as a bikini line. Let me show that on this camera. So bikini line, I want to mobilize that shoulder. What I'm doing here, I pull that band first. After, it's coming right around me. So if I'm standing the closest hip, closest my side to her hip, kind of grab that in the back, put this under my butt and hold it with this arm. You see, it's right behind me. What I can do, I can step back and I don't need to push. This will, my arm only control, but I walk with this band on me. Look, it's already like get the band in tension, but I don't feel a lot of work, because if I just pull with my arm, I'm going to hold it with my arm. It's going to create a lot of like tension in me. I'm not capable to do many therapy like that. I'm going to get tired. So what I'm doing here, I bring this leg and ask her slide up and down, and I put too much like pressure on there. Here we go. Yeah, just like that. You see, when I release that band, when she stand up, she will feel much better. You can do side to side. Let me show you. Like this, open up, here we go, or cross, and come back, and all that kind of stuff. And like I said, I do a lot of stuff, rotation, help people to rotate. Let's say we test this rolling exercise and someone can rotate. What I'm doing, I put that band around that people, and I help them to rotate. I help them. I usually do this on the floor. And this is what I want to say. Let's say neck muscle. Remember this, people, when they lay down on the table and the head is in the air, and you said, relax, and he can relax. What I'm doing, I get that small ball and put this under the neck and ask him to push for like 2-3 minutes. He's going to push. He's going to reactivate all those muscles, and it's going to be beneficial for them. Trust me. From this position, he's going to be more that neutralize that spine. And this is great because here, anterior tilt of your neck create a lot of problem. It's oxygen dystrophy, blood flow dystrophy, and it's create what? Stroke. This is the most common problems in our society. Whoa. I wanted to kill you. And that's create a lot of problem in our society, like so many strokes, because people at anterior tilt, it's no oxygen, no blood. They try to get up, do some exercise, a lot of energy, and the blood go to the head. Boom, stop happening. So pay attention, use those tools, and I hope it's gonna save your hands. And it's gonna be beneficial for your clients. That's the idea, to make sure the clients is reactivate those muscles. They not just You're not just to stretch them, you activate them. You need the balance. All right, thanks for watching, and we'll see you next week. Have a good day.